Welcome, everybody. This is Dr. David Pascal, and you are with me on my weekly Facebook Live on our complex regional pain syndrome solutions. And today I'm going to be talking to you about some of the treatment modalities that we have. I do have about 63, 64 different modalities in my office that we use on our patients. We always try to dial in the right care for each individual patient. And today we are going to be talking about pulsed electromagnetic field therapy, commonly called PEMF, also frequency specific microcurrent, FSM, and our photon generator from Germany. So first of all, we are going to be talking about PEMF, pulsed electromagnetic field. The Earth emits a low-level electromagnetic field, and its wavelength is about 7.2 hertz. It's very interesting because what the research scientists have found is if you expose your body to this specific wavelength of the electromagnetic field, it will stimulate the cells of your body to heal. It will stimulate your body to do all the good things that it needs. So that means normalizing your hormone levels, normalizing organ function, balancing your autonomic nervous system, the sympathetic and the parasympathetic, accelerating healing in your body. And how do you expose your body to PMF? Well, on your own, you can go to the ocean and walk on the sand or jump into the water. You can go to the park or your own backyard and lay on the grass. You've probably noticed that when you are at the beach or you're walking through a forest or your bare feet are on the earth, when you're able to come into contact with this magnetic field that is being emitted from the earth, that you feel better. And that is why you feel better. And so the research scientists have been able to isolate this frequency and create a machine that will generate it. It does it through a big magnetic coil, and in our office we have a pad that you lean against, and then the magnetic field shoots out from that. And over a 15 to 25 minute time period, we can accelerate your cellular repair, normalize body function. One of the most fascinating things that I find about that is that this wavelength of light, of the electromagnetic field, remember a wavelength is defined as from the peak to the peak of a wave, right? Or the trough to the trough of a wave. But we'll talk about the top to the top, right? The top of one wave to the top of the wave next to it, that's the wavelength. And it just happens that the wavelength of this energy that heals our body that distance is equal to the distance of the Earth's atmosphere, the diameter. So the area where our bodies can exist, which is on planet Earth in atmosphere, and stay alive, is equal to the very same wavelength that heals our bodies. I just found that rather fascinating. So we use that on just about all of our patients because it addresses all the cells in our body. So it doesn't matter what's going on, PEMF is going to be great for you. The next thing we have is frequency-specific microcurrents. You probably know that our body is an electrical system. It's alive. We generate electricity, and we need electricity for the cells to stay alive. And all of our cells, all of our tissues, all of our organs have their own little vibration to them. So that means that a liver vibrates differently from a bone. Bone vibrates differently from a nerve. Nerve has its own separate vibration from a disc. Well, once again, our friends, the research scientists, have figured out what the optimal resonance or vibration is of all the different tissues in our body. And a company made a little small generator that generates a low level frequency specific to each tissue. So if I have a patient come in and they have nerve inflammation, I can put the frequency specific microcurrent set to nerve and run a microcurrent. You won't feel it. It's very low level. Some people might feel a slight tingle, but for the most part, there's no feeling associated with it because it's different from like a muscle stim machine that's trying to run a big current through a body to contract a muscle, or a TENS unit, which is sending this little irritating signal to try to turn off the pain signals in your body. This is frequency specific to a given tissue in your body. So when I'm evaluating the individual patient in front of me, I am looking for, okay, what do we want to address today? Do we want to address their brain? Do we want to address their liver? Do we want to address a bone in their body? And so we can dial in their care specific to the body part that we want to address. And when we do that, we get accelerated healing. So I'm a big fan of FSM, frequency specific microcurrent. And then the other last piece of equipment that I want to talk to you about is a very rare, unique machine. We call it the Photon generator. I picked it up several years ago in Germany. There is a German company. The inventor of it passed away during COVID, unfortunately. So now there'll never be another one. But what it does is it sends out light and PMF through batons. So the patient holds on to these like clear plastic batons, and then we can dial in the exact frequency, like the frequency specific microcurrent, and the wavelength of light and the PMF all through these batons. So you're sitting in a chair, you're holding these batons. Again, it can be 10 minutes, it can be 25 minutes, all just depends on what we're doing on that given day. And it again will accelerate tissue repair, normalize organ function. It is amazing for people that have anxiety, depression. We will put this on them, and there is a huge change for almost every single patient, even from the very first treatment. So that's just an example of 3 of my 62, 3, 4 modalities that I have. I think that every couple of weeks we'll talk about another few, and if there's anybody that is online right now that has a question, I'll be glad to take that. If you are watching this tape delayed and you have a question, feel free to contact my office. You can email us, you can message us here in our Facebook group, or you can call us. Always looking to give more information and help more people. Do we have any questions? All right, so right now we don't have any questions. If you think of one that you'd like to ask, it doesn't have to be specific to these modalities. Feel free to reach out. And I do want to say that each of these machines, they all have knockoffs. Everything has a knockoff. You know, there's a knockoff to your cologne or perfume, to your clothes, to everything. There's always a cheaper version. And what I have found is, okay, if you're, gonna go out, so what if you're wearing a real polo shirt or a knockoff polo shirt? That doesn't matter, or real Nikes or some fake Nikes. But what does matter is things that you are exposing your body to or ingesting. This is not the time to cut corners. And because I've seen, if you don't have the right frequency, the right wavelength, the right nutritional makeup on the supplement, then you not only could be doing outright harm to the body, which I have seen, you could be wasting your time. And that might be the biggest risk, because when you waste your time, when you're not getting the right care, when you're delaying the correct, proper care, then whatever your condition is, it's not staying static. It's getting worse and worse and worse. So I spend more money on the equipment that I have to make sure that it's gone through the rigorous testings, that it is what it says it is, for your well-being. A good example is we have a machine that has a metal array that goes into water to help pull toxins out of the body. And I can buy this little array because they are only good for about 50 treatments. I can buy them at Walmart for like $5 or $10. The ones that I buy are $125. I don't charge more because I buy the more expensive arrays. So why do I buy the most expensive arrays or the more expensive arrays? Because I know that quality of that product is higher. And when I'm trying to pull toxins out of the body, I don't need to run the risk of, oh, does this machine have lead in it? Does it have some other chemical in it, some heavy metal that I don't know about that could harm my patient? So everything that we use, we rigorously do our due diligence to make sure that it's safe and effective. We don't use knockoffs. So I hope that helps. Hope you are moving toward health, and I look forward to seeing you someday in my office.